Good morning, examiners. My name is Mohd Nazri bin Ambo Puang and I am a student in the Bachelor of Medical Health and Science program at Open University Malaysia. It is my pleasure to present my research proposal titled The Impact of Workload, Burnout and Stress Level on Mental Health Among Assistant Medical Officers in Sabah. This study addressed a critical and often overlooked issue in healthcare: the mental health challenges faced by Assistant Medical Officer or AMOs in rural and resource-constrained settings. With this research, I hope to shed a light on the unique pressures that AMOs face and how they impact their mental well-being. Let's begin by understanding the motivation for this study. Introduction. Mental health is a fundamental component of healthcare. For healthcare workers, particularly AMOs, mental well-being is essential not only for their own health but also for the quality of care they provide to patients. In Sabah, AMOs play a crucial role in healthcare delivery. Often working in remote and rural areas with limited resources, however, many of them face significant challenges such as a heavy workload, high stress level, and burnout. Most research to date has focused on the mental health of doctors and nurses, leaving AMOs underrepresented in the literature. In addition, the unique stressors of working in rural healthcare, including geographical isolation and inadequate resources, are rarely explored in the depth. This study aims to fill this gap by specifically focusing on how workloads, burnout, and stress affect the mental health of AMOs in Sabah. Research background. AMOs are essential healthcare workers in Sabah, providing primary care, managing emergencies, and performing administrative duties. They work in often challenging conditions, particularly in remote and rural areas where healthcare resources are stretched thin. These areas are also understaffed, putting additional pressure on AMOs to manage larger patient volumes and longer shifts. Unfortunately, the limited mental health resources in these areas make it difficult for AMOs to cope with their demands. Given the significant role that AMOs play, it's crucial to address their mental health. Poor mental health not only affects their well-being, but also impact the healthcare system's effectiveness and patient outcomes. By understanding the challenges AMOs face, we can develop strategies to improve both their mental health and the overall quality of healthcare services in rural Sabah. Problem statement. AMOs in Sabah face a multitude of challenges in their daily work. Firstly, they are burdened with a high workload due to staff shortages and large patient volumes. Secondly, burnout is prevalent, driven by long working hours, unclear job roles, and insufficient managerial support. Thirdly, stress levels are heightened by the dual responsibilities of clinical and administrative work, alongside the high expectations placed on them. These challenges not only affect AMO's health, but also contribute to lower job satisfaction, absenteeism, and reduction in the quality of patient care. Despite the critical role AMOs play, there has been limited research into how their factors impact their mental health. This study aims to address this gap and provide valuable insight into their important issues. Research questions and objectives. To guide this study, we have formulated 3 primary research questions. First, how does workload affect the mental health of AMOs in Sabah? Second, what is the impact of burnout on the mental health of AMOs? Third, to what extent do stress levels affect the mental health of AMOs? The general objectives of this study is to examine the overall impact of workload, burnout, and stress on the mental health of AMOs. Specifically, we aim to investigate the relationship between workload and mental health, analyze the effect of burnout on mental health, and evaluate the influence of stress on mental health. By addressing these questions, the study will provide critical insight into how these factors interact and contribute to the mental health challenges faced by AMOs. Research hypothesis. Based on existing literature and theoretical models, we propose the following hypothesis. H1. Workload has a positive impact on the mental health of AMOs in Sabah. Research has shown that heavy workload can lead to emotional exhaustion, anxiety, and other mental health issues. H2. Burnout has a positive impact on the mental health of AMOs as described in McCulloch's burnout theory, which highlights emotional exhausting, depersonalization, and reduced personal accomplishment as core component of burnout. H3. High stress level have a positive impact on the mental health of AMOs in Sabah. Chronic stress is known to reduce resilience and coping capacity, especially in high-pressure environments like rural healthcare settings. Okay, let's go into significations for the study. This study is necessary because it addresses a critical gap in our understanding of the mental health challenges faced by AMOs in Sabah. Despite their central role in healthcare, AMOs often work under tremendous pressure, which adversely affect their mental health and job performance. Understanding the impact of workload, burnout, and stress is essential to developing strategies that can improve their mental well-being. Why is the study important? The mental health of AMOs directly affect the quality of care they provide to patients. Poor mental health, such as burnout or stress, is linked to increased medical errors and a lower standard of care. By addressing this issue, we can ensure that AMOs are better equipped to serve their communities and ultimately improving patients' outcome. How can this study contribute? For patients, AMOs with better mental health are more capable of providing high-quality services to improve patient outcomes. Literature review. This study is grounded in two key theoretical frameworks. First, the Job Demands Resources JDR model. This model explains how high job demands, such as workload and stress, deplete resources leading to burnout. Second, Maslach's burnout theory. This framework defines burnout as emotional exhaustion, depersonalization, and reduced sense of personal accomplishment. These theories provide a lens through which to understand how workload, burnout, and stress contribute to negative mental health outcomes, including anxiety, depression, and reduced capacity to cope with their job demands. Research framework. This conceptual framework illustrates the relationship between the independent variables, workload, burnout, and stress, and the dependent variable, mental health. Each of these independent variables is hypothesized to have a negative impact on AMO's mental health. This visual framework helps clarify how these factors are interrelated and the pathway through which they may affect the mental well-being of AMOs. Research methodology. This study will use a survey-based quantitative design to assess the relationship between workload, burnout, stress, and mental health. The target population is AMOs working in public healthcare facilities in Sabah, and we aim to sample at least 119 participants calculated using G-Power. The data will be collected using a structured questionnaire, which will include the General Health Questionnaire (GHQ) to measure mental health. Descriptive statistics will be used to summarize the data, and regression analysis will help test the hypothesis and explore the relationship between variables. Conclusion. In conclusion, this study aims to highlight how workload, burnout, and stress significantly impact the mental health of AMOs in Sabah. By addressing these factors, we can improve healthcare delivery, enhance AMOs' well-being, and ensure better patient outcomes. The insight gained from this research will provide actionable recommendations for policymakers to develop mental health support programs and interventions. Future research could explore interventions to mitigate these challenges and consider longitudinal studies to establish causal relationship. Thank you for your attention. I will be happy to take any questions you may have. Provide a clear justification for why this study is necessary. Is this study important, and how can it contribute to patient, society and institutions? This study is necessary because it addresses a critical gap in our understanding of the mental health challenges faced by AMOs in Sabah. Despite their central role in healthcare, AMOs often work under tremendous pressure, which adversely affect their mental health and job performance. Understanding the impact of workload, burnout, and stress is essential to developing strategies that can improve their mental well-being. Why is this study important? The mental health of AMOs directly affect the quality of care they provide to patients. Poor mental health, such as burnout or stress, is linked to increased medical error and a lower standard of care. By addressing these issues, we can ensure that AMOs are better equipped to serve their communities, ultimately improving patient outcomes. So, how can this study contribute? First, for a patient, AMOs with better mental health are more capable of providing high-quality care, leading to improved patient outcomes. For society, a healthier AMOs workforce help ensure the sustainability of healthcare services, especially in underserved communities. For institutions, healthcare institutions can use the finding to design mental health support programs and interventions that improve job satisfaction, reduce absenteeism, and enhance overall workforce productivity. This study is vital not only for the well-being of AMOs, but also for the quality of healthcare in rural areas and the broader quality healthcare system in Sabah. That's all for me. Thank you once again for your time and attention.